Hi, everyone. So, a full disclaimer, I always try to give this when I'm speaking. It's ironic. I think that my job is to speak publicly because, bear with me, throughout my military career, I was injured multiple times. Some of those were some pretty severe traumatic brain injuries due to very close proximity to IED blasts. So I had some pretty significant brain damage and went through 2.5 years of cognitive rehabilitation to learn how to speak again, learn how to associate objects with what they're used for, kind of the whole gambit. So what you're hearing now is essentially the best we're gonna get. I know what I wanna say 90% of the time. I can see it here, but getting it to go from here to here and out to you can sometimes be problematic. Please bear with me. It's as frustrating as it is on my end. I know it's equally or more frustrating to try to listen to. I try to work through it. Hopefully we'll be smooth. Most likely it'll train wreck off to the left. But if it does, I'll try to steer it back. So I apologize ahead of time. Thank you. Thank you. I'm a lot of things. One is a hot mess, if you ask my wife. I'm also a chronic pain patient, and I am in recovery. I was also dependent on opiate pain medication for a very long time, and knock on wood, we'll make it to 7.5 years in about 14 days. Thank you. Oh, chance. I like a lot of people you've heard today, my goal was not to become dependent on opiates. For me as a chronic pain patient, it just kind of happened, as crazy as that sounds. And that started on September 11th, 2001. At the time, I was very early in my career. I was stationed in Washington, D.C., and I was a first responder. At the time, I was an escort for President Clinton, and then President Bush, and I was a sentinel at the Tomb of the Unknowns. And on September 11th, I was 21 years old. The plane hit the Pentagon while I was stationed at Fort Myer, right across the street. At 23 minutes after the plane hit, myself and about 235 members of our unit responded. We were there 23 minutes later. And I was trying to reach a woman that was trapped under 3 floors of debris that had collapsed on her and trapped her from the waist down. As I was trying to dig through that rubble, a load-bearing wall collapsed on me, and I fractured my spine and damaged several discs. That was my first injury. Throughout my career, I deployed 8 times for a cumulative 6 years time rotated in Iraq, Afghanistan, the Horn of Africa. Through each deployment, I was injured. I always joke, I flew in with a team. I always had my own private plane back. It was a medevac plane. I traveled 280 days a year, a million miler with American Airlines, but I still have yet to see one frequent flyer mile from the Army or the Air Force. Not holding my breath. Doubt those are gonna come. But I don't know if it's because I'm 6'8" and 220, I'm accident prone, or I'm just a big target. I get injured a lot. And that was kind of how my career went. Following 9/11, we had my first of 6 spine surgeries to repair damage. 11 months after that, I left for my first deployment to Afghanistan. During that deployment, we were on a nighttime operation targeting the head of an IED manufacturing and distribution cell and close to the border of Pakistan. We came in on 2 Chinook helicopters. We came in on target. The way this is all supposed to work is there are 2 ramps that drop from the back of the helicopters. There's a crew member attaches a rope, they give a signal, and then the team comes out. You make a 3-foot jump from about here to here, and grab the rope, slide down the rope like a fireman down a fire pole, and then process the target. In my case, as we came on target, it was very windy. We were taking incoming from the target's compound. So while the pilot's trying to maintain the integrity of the helicopter, and the helicopter's getting buffeted around by wind, the rope went out, and I got the signal to go. On that signal to go, I was the first person of a 6-man team out of the back of that helicopter, and right as I made that jump, the pilot had to move the helicopter a very small amount to the left, caused the rope to counterswing, so I just went straight down. I fell 20 meters or 2 stories, roughly, onto the roof of the target's house, and I broke my back. The 5 SEALs behind me did not realize I missed the rope. So they all came down 1, 2, 3, 4, 5, like a jackhammer. They executed the operation the way we're trained. I executed it a different way. Maybe not as effectively. I got down there faster, quicker than they did. But I was medevaced. We came back, we fixed it. We fixed the damage, and following the pattern the rest of my career, I was very aggressive with my medical team as far as fix me, get my boxes checked, sign where you need to sign. If we need to cut this rehab short and that PT short, whatever we need to do, get me ready, get me fixed, get me back in rotation so I can do my job. As an Arabic Special Operations Interrogator, there's not a lot of us. At that time, there were not a lot of us. So it's a very small community. And what weighed on me was if I take longer than necessary or I don't skip a couple steps, there's a very good likelihood I know who has to take my spot in that rotation. And not only do I know that person, I probably know that person's spouse. Their family's been over my family's home for barbecues, for Thanksgiving. So the foremost thought in my mind is, God forbid somebody takes my spot when I could have easily just skipped a few more months of that therapy and gone back. And it caught up with me very quickly. During my last deployment to Iraq, it was a 15-month deployment. I made it 12 months in, and during the last 12 months, I just was in a steep decline. I was dealing with a lot of pain. The way we dealt with the pain downrange was just a series of Band-Aids. I was eating Toradol, Tramadol. I was eating Tramadol like they were Tic Tacs. I had a Ziploc bag full of Tramadol. We built in a 2 minutes extra into our pre-combat timeline, so we would do radio checks, weapons would go hot. Right before they would open the gate, I'd inject myself with 60 mils of Toradol. I was doing that for about 6 months. Just enough to tamper down the pain, but also tearing me up inside. I'm sure everybody's familiar with it, a spinal epidural, typically done in a pretty sterile environment, like a ASC, clinical procedure room. We knocked 2 of them out on the back deck of a Humvee at my insistence. You know, the doctors are saying this is not a good idea, and I'm stubborn, non-compliant patient, and said, yeah, let's do it. It caught up with me on that 12-month anniversary to the day into a 15-month deployment when I stepped out of the Humvee and I couldn't walk. Came back and medevaced, and the answer my medical team said was, you just have a perfect storm. You got multiple spine-related surgeries, minimal recovery time, and then just what the effect combat has on your body on a daily basis. So you have irreparable, if not some severe nerve and structural damage. So the fix was an anterior-posterior interbody fusion at 6 levels, and we removed 2 more discs. So we just built a titanium cage around my spine, pulled a couple more discs out, put a bunch of pins, rods, and screws, and put me back together. I spent 3 months at Duke Hospital recovering, went home, and was in more pain than I was at home 3 months post-op than before I went on the table at Duke. So, and that situation very quickly deteriorated. I knew I was in a completely different situation as far as pain and something I experienced before when I'm not coming out of the guest room for days at a time. I'm not showering for a week. I'm not interacting with my family. The pain completely took over my life. The pain for me dominated every second, minute, hour, thought, plan, relationship, aspect. Every part of my life is dominated by the pain. And then that quickly transferred and had that ripple effect on my family. At the time, my daughter Mackenzie was 2 and 3 years old. I feel like I'm in so much pain that it's not worth me getting out of bed to walk downstairs to sit down and eat breakfast with her. It's going to, because all that's going to happen is I'm going to be in pain, angry, mad that I'm down there, mad that I'm having to sit with her, and that's going to make me more frustrated that it's still in so much pain after I've had this surgery, and I still can't eat breakfast with my daughter without getting upset. So what's the answer? I go back to my doctors, and the answer was long-term medicine management. I said, okay, what does that look like? For me, the answer was, oh, we've done everything we can do, so you're going to be on meds the rest of your life. My daily dose, and that train left the station at 500 miles an hour without a conductor. It was gone. My daily dose was 240 milligrams of Oxycontin ER, 60 milligrams of oxycodone Percocet, the 5 mg tabs, and 40 mgs of Valium. That's why I took a day. It's easy. It's not easy. You can throw those numbers around a lot, but I think it's easier to show it. So please, after I get done, nobody eat any of these. These have been on conference room and hotel floors all over the country and other countries. But for all intents and purposes, these big red ones, these are my 80 mg Oxy ER, the heavy hitters. 2, 6, 7, 9. The white are my Percocet, 5 mg. And these are my 0.5 mg Valium. So this is what I took every day. That's a significant amount of medication. This is your eyes rolled in the back of your head, nodding out in mid-conversation, drooling on yourself. Not a pleasant situation. But it's day one. That's what I took every month. That's an exact count, except for, see, I know where my pills are. It's an 80 mg. Oh, and there's one more. I joke because I think it's a military dark humor type thing. But this is every month, and I used to get this times 3. I would get my scripts in a 3-month supply, so I would get 2 brown paper bags like they came in a grocery bag. if I thought that the pain controlling my life was a bad situation, the ineffective way of controlling my pain and the dependency on the medication was exponentially worse. In my case, the part that disturbs me the most is I don't remember a great deal of that 2.5 years. I can tell you who does remember. Mackenzie remembers. My ex-wife, my now ex-wife, remembers. And all I know is from what people have told me. I've seen pictures, I've seen some video. But I can tell you when your 4-year-old daughter asks you to read her a story before bedtime, and your immediate, without delay, response is to use some of the foulest language you can imagine at the highest possible decibel level, as close as you can to her face, and spend the next 15 minutes verbally berating her, because if you read that story, she has the audacity to ask you to read a story before bed. If you read that story, you're going to be late to CVS and late to get your refill, and that means 6 hours post-close CVS, I'm going into full-blown withdrawal. And that's minor. That's one minor example of the failure of a father I was to her, and how far and how deeply I failed her and my ex-wife. And like I said, I don't remember it. They bore the brunt of that. And the whole time, my life is falling apart. I don't even really fully understand it because I'm a 6'8", 200-pound person occupying space. I accidentally OD'd twice. And I got to the point where I tried to kill myself. I took 3 months of Percocet. I'll never figure out how to ask appropriately, nor do I deserve an apology from Mackenzie, or an acceptance of an apology from Mackenzie. I completely let her down. She's the only daughter I'll ever have. I'll never figure out how to make this time up to her or to my ex-wife. I deeply, deeply regret that. And what makes me mad about it still today, and this was 7.5 years ago, is this is not how it had to happen. I definitely take ownership in this. I didn't ask my doctor questions. I was not my own advocate. I said, okay, this is what we're gonna do. And I looked up and I had burnt everything to the ground. There's 25 million chronic pain patients in the United States. 25 million of me, which adds a whole nother aspect when we're talking about the opioid epidemic and access to care, and the reason why people end up with their life revolving around this, and trying to figure out how to apologize to their sons and daughters and mothers and fathers and spouses. After my failed attempt at suicide, I went back to my doctor My primary care was managing this. The same doctor who diagnoses me for strep throat or ear infection is writing my 3 months worth of script for this. At the 2.5-year mark, I asked her, is there any, and we're at the point of desperation, is there anything else we can do? Because this is killing me. And it's not working. It wasn't until that point she asked me if I wanted a referral to an interventional pain management doctor. My reply to her was, what is that? It should not take me 2.5 years with a full-blown dependency on medication and my life falling apart before I hear about a referral to a pain doctor, a doctor whose only job it is to deal with people like me in situations like mine. I got the referrals soon after that. I met with a pain doctor at Fort Bragg, and that's where I learned about one of the only options that was available to me. I was in front of a doctor who only focused on pain, and that's when I learned about spinal cord stimulation. It's a modality used to treat chronic pain. In my case, and why it fit for me especially, is because of the indications. I did and have a lot of pain, lower axial back pain, radiculopathy, and this therapy meshed well with my indications and my symptomology. But it took a divorce, a ruined relationship with my daughter, an addiction, and the end of my career before I even got there. And I'm telling, I want to tell you this not because I want a pat on the back or a round of applause or a thank you. I'm trying to put this in perspective, and I'm a big, dumb Army guy. So please stay with me. It's going to be easy, I think, because I'm a big, dumb Army guy. If it takes somebody who is on the Joint Special Operations Command, Special Intelligence Task Force, whose job it is to break Osama bin Laden's #2 lieutenant and report directly to General McChrystal, who then takes my report directly to Secretary Rumsfeld, who then takes it to the NSA, then moves satellites around to look at the intelligence I gathered during the conduct of my job, and on top of that, the recipient of a Bronze Star for Valor. If it takes that type of person this much difficulty to get to a pain management referral doctor, how incredibly difficult is it for somebody, and for anybody else? It blows my mind. This should not happen. This should not happen. And if it can happen to somebody who received the Bronze Star for Valor and was allowed to carry a loaded weapon and guard the life of a president, as 2 sitting presidents of the United States, trust me, it can happen to you. It can happen to you. I've worked very closely with individuals that this issue is very, very close to their heart. Steve LaPierre is here from Boston Scientific, and he works in DC, and he's given me the opportunity to work with lawmakers and legislators, trying, especially on the veteran side of things, trying to improve access to care, trying to integrate a balanced approach to pain management, not here's a opioid fog, cover up your pain, hope you feel better, see you later with your dependency. We're not going to go with a more expensive treatment option because it's only when we buy OxyContin in a 500 count bottle, it's only 4 cents as opposed to a much more expensive treatment option like spinal cord stimulation. So we'll go with this cheaper treatment option until you're a full-blown addict, and then we'll deal with the cost of rehabilitation. And that mess. We're finally making progress. There's bipartisan support. Look at the HHS Opioid Task Force and some of the actionable items they've come out with recently. 2 bills passed in the past 2 weeks, Steve. Two bills in the past 2 years. I get aggressive. 2 bills in the past 2 years, and a task force devoted to this, not just people sitting around saying, these are great ideas, I think we should do this, actually putting out actionable things that we can move on today. And then organizations like Blue Cross Foundation, who are already on the ground working. We're light years from where we were when I started with this. But we absolutely have room to grow, and we're gaining momentum. And I am extremely thankful for that. I'm extremely grateful to the work that you do on behalf of all the people that you don't see. You don't see the effect it has on Mackenzie when I can go to I live outside of Orlando, in a place called Winter Park. It's close to a amusement park. I'm not going to say the name because I'll go into full-blown PTSD anxiety attack. But it's associated with a mouse and American Express push notifications to your phone saying you're over your limit. Mackenzie's 11 years old now. I think I have about 18, 20 more months best that she still wants to hang out with me. She still wants to be around Dad. If you, thank you. And trust and believe, I am holding on to every one of those days as long and hard as I can for as long as I can, because I don't deserve them, and I have a second chance to take advantage of them. And when you have an 11-year-old daughter who live where I live, and that place is that place, that's where you go. Don't care what your situation is, I'm just telling you, that's what it is. And that place, again, to remain unnamed, will break me down shotgun style. It will make, just to drive there, I'm already thinking about how much pain it's going to cause. Because somehow, when you get in the parking lot and you get on the tram, it's a 3-hour shuttle ride. The gate's like 50 meters away, but it takes 3 hours. By the time we've walked around for 10 hours until noon, and she's convinced me to stay until midnight, even though I told her before we weren't leaving the house, we're gonna leave at noon. By noon, she's gonna be an interrogator because she's already taught me to stay until midnight to watch the fireworks. And we walk around them all day, and we take a 3-hour shuttle ride back, get back. That will put me out of commission and broke. But it's what she loves to do, and she wants to do it with me, and I want to be there with her and enjoy it with her and be present. And in the moment, that would be impossible if I didn't have access to this integrated approach to pain management that I've now been in and have built upon over the past 8 years since I was implanted. I can go to Disney. I can go to the mouse house. Leave it at that. I can go to the mouse house and I can be in pain, and I'll be at a 3. And if I can be at a 3 on a 1 to 10, I'll take a 3 all day. God bless America. Hallelujah. I'll take it. I shoot to be at a 3. I can be at a 3. And my stimulator, if you look, I have a program called WDW, Walt Disney Place. Being able to have that stimulator, providing that therapy in conjunction with the other things I do, I exercise, I try to eat well as much as I can. And trust me, I know every Chili's waiter and every airport between here and Australia. I'm able to manage my pain effectively. And instead of going to that place with Mackenzie and having the pain be a header for that day, it's a footnote, if it's even there. And that's a chance that I almost lost countless times, and I'm extremely grateful for. And if I can help another father, another mother, another spouse, help encourage them to ask their provider questions, be their own advocate, and ask that we together, private sector, government sector, come together and we're not just a number. We're not 25 million people in chronic pain. We're not the 18 people that died yesterday from opioid overdose. We're all dads, moms. We're all people. And we want to be good parents, and we want to be good spouses. And a lot of us don't get that second chance. And I'm very appreciative of that. Thank you all very, very much for your time. Thank you very much for the applause.